For a very large share of Americans, one company sits quietly and enormously in the middle of their health. It may decide what their insurance will and will not cover. It may increasingly employ their doctor. It may manage their prescriptions and hold vast records of their medical lives. And at almost every one of those steps, it takes its cut. It is one of the largest companies in the United States. And yet, most people rarely think of it as a single entity at all. It is called United Health Group, and this is a series about the companies that run the world. United Health represents a distinctly modern kind of power, the power of the intermediary in a vast and bewildering system. It does not, at its core, make medicines or cure diseases. Instead, it operates the immense complex machinery of payment and administration that sits at the heart of the most expensive healthcare system on earth, the one in the United States. It is, in essence, the plumbing through which an astonishing river of healthcare money flows. The company really has two great halves, and understanding them is the key to everything. The first is United Healthcare, the largest health insurance business in America, which collects premiums from tens of millions of people and employers and pays out for their care. The second, and increasingly the more important, is a sprawling arm called Optum, which has quietly become one of the most powerful forces in all of American medicine. Optum is where the story becomes genuinely remarkable. Over years of relentless acquisition, it has grown into a vast empire of health services. It employs or is affiliated with an enormous number of physicians. It runs clinics and surgical centers. It operates one of the country's largest pharmacy benefit managers, and it commands some of the most extensive troves of health data anywhere in the world. It is a health services giant hiding inside an insurance company. And that points to the true genius and the true controversy of the whole structure, its vertical integration. United Health is becoming, all at once, the entity that insures you, the entity that owns your doctor, the entity that manages your drugs, and the entity that analyzes your data. In such a system, a dollar spent on your healthcare can flow from one of its pockets into another, with the company profiting at nearly every stage of the journey. Consider just one of those layers, the pharmacy benefit manager. These are the powerful and famously opaque middlemen who sit between the drug companies, the pharmacies, and the patients, negotiating prices and deciding which medicines are covered. A handful of them, Optum's among the largest, quietly shape what Americans pay at the pharmacy counter in ways almost no ordinary person can see or understand. The sheer scale of all this is staggering. United Health Group takes in revenue running to hundreds of billions of dollars a year, placing it among the very largest companies in the entire United States, by that measure rivaling the giants of technology and retail. Its size is, in a real sense, a mirror held up to a single, sobering fact: just how enormous and how expensive American healthcare has become. The moat protecting this position is formidable and many-layered. It is built from immense scale, from the priceless data it accumulates, from the deep integration of its many parts, and from its entrenchment in the complex government and employer programs that so much of American health coverage runs through. The very complexity of the system, which baffles ordinary citizens, is a fortress that protects the giant administering it. A great deal of its growth, too, flows from the government itself. Through the program known as Medicare Advantage, the company is paid public money to manage the healthcare of millions of older Americans. It has become one of the largest and most lucrative such arrangements in the country, and, increasingly, one of the most scrutinized, as hard questions mount about how these giant private insurers bill the taxpayer. That data deserves its own moment because it may be the deepest source of power of all. By sitting simultaneously across insurance, care delivery, and pharmacy, United Health can see patterns in the health of the population that almost no one else can. That knowledge can be used to manage care and cost more efficiently. It can also be used, critics fear, to steer decisions in ways that quietly serve the company's bottom line. And here the story collides, painfully, with real human anguish. For all its efficiency, this is a company that profits by administering a system in which many people struggle to afford care, are denied the treatment they need, and drown in bewildering bills. Behind the vast revenue are a great many stories of real distress. That resentment, long simmering beneath the surface, erupted into full national view in a devastating way. When a shocking act of violence struck one of its senior executives, it unleashed a torrent of public fury, not at the crime itself, which was widely condemned, but at the entire health insurance system the company had come to symbolize. This exposes the most uncomfortable truth at the center of the whole model. A company like this does not, on the whole, prosper by making healthcare simpler or cheaper or easier to navigate. In many ways, it prospers precisely because the system is so complex and so costly. Simplicity would be its enemy. The maze itself, confusing and expensive, is the very thing that sustains the guides who profit from leading us through it. So we reach the question this series always asks, of what would break if United Health vanished? And the answer is that a huge portion of American healthcare would seize up almost immediately. The payment of claims, the networks of doctors, the flow of prescriptions for tens of millions of people all run through its systems. Its machinery is now so deeply woven into the daily functioning of American medicine that its sudden absence would be pure chaos. Which brings us to the uncomfortable question, in one of its most ethically charged forms. Is it healthy or even safe for a single company to be, at the same time, your insurer, your doctor's employer, the manager of your medicines, and the keeper of your health data, all while answering, first and foremost, to its shareholders? It is a concentration of power over something as intimate as human health that gives a great many people profound unease. To be fair, and it deserves a hearing, there is a real argument on the other side. United Health operates within a dysfunctional system it did not create, and its scale and integration can, at their best, genuinely coordinate care and squeeze out waste. Its Medicare programs serve millions of older Americans. In a fragmented and chaotic healthcare landscape, there is a case that someone has to impose order, and that its machinery, for all its faults, sometimes does. And that is the deeper lesson of this particular giant. There is a vast and durable kind of power in positioning yourself as the indispensable intermediary of an essential, complicated system, taking a toll on the flow rather than producing the thing itself. United Health understood that in the sprawling, costly world of American healthcare, the money to be made is not only in the curing, but in the controlling of who gets what and at what price. So the next time you navigate a confusing medical bill, or wait to learn whether a treatment will be covered, or pick up a prescription whose price makes no sense, consider the quiet giant likely standing somewhere in that transaction. United Health is a reminder that in the most complex systems humans build, some of the greatest fortunes are made not by those who heal, but by those who position themselves in the middle and quietly master the flow.